Good afternoon, Ms. Cook. My name is Keller. I'm a student physical therapist here at GRU. How are you doing today?
Doing good.
So what brings you in to see me today out here at this fine institution?
Well, I've been having more symptoms lately due to MS, and so the doctor recommended that I come.
Okay. So you've been having more symptoms. I understand you might have had a relapse recently?
Yes, I did. I had to go to the hospital. I was also just sick, so
Sick,
it
okay.
kind of all went together.
What kind of sickness did you have, do you know?
The flu or
Is
something.
it the flu? Okay.
And then it like sparked all of this.
Okay, all right. Are you doing better from the flu now? Or
Yeah.
are you, okay. All right, so tell me about, since the relapse, what has it caused you not to be able to do that you were doing before, to see what we can get back to?
Well, it's just causing me to be really uncoordinated, like on the right side of my body.
Okay, so your right side's more affected. Is your left side, are you having some coordination issues there at all?
No, not that I've noticed.
Okay, all right. So how about as far as everyday life goes, as far as in the house or at the grocery store or things like that? Are you able to get out and about in the community?
I can a little bit, but it's kind of embarrassing.
Okay. Okay, so are there tasks at the house you have trouble with? Do you have trouble putting away dishes? Do you have trouble brushing your teeth or going to the bathroom or anything like that?
I just try to use my left hand to do most of those things, and it's okay, but yeah, I have trouble with them.
Okay. How about any weaknesses? Has this caused you to be really weak, or you just can't have trouble control?
I just feel weak overall, like I'm still recovering from being sick, but I don't feel like, I don't know what you're saying.
Any pain?
No.
Nowhere. Have you had any falls or anything due to this?
I did fall a few days ago.
A few days ago.
I just tripped when I was walking in my yard.
Okay. Now, did you get any bumps or bruises anywhere?
I skinned my knee, but
You skinned
that's
your knee?
about it.
Okay. How's it looking now?
It's fine.
Okay, that's good. Okay. And nowhere else? You didn't hurt yourself anywhere else? Okay. What about, I know fatigue is a common, getting really tired is a common thing, symptom of MS. So how about fatigue or getting tired? Do you notice that? Or?
Yeah, it's been worse this time since being in the hospital.
Okay.
So I
Okay.
usually have to lay down like 3 or 4 times during the day.
Okay. What would you say makes you most tired? Is it walking? Is it standing?
I guess walking and like doing laundry, unloading the dishwasher.
Okay. All right, well, we're going to write those things down. We're going to work on it. And if you don't mind, I want to go ahead and get your blood pressure and your heart rate, make sure we're safe to do some activities today and work on some things. So I'm just going to come to this side over here. I'm going to get your heart rate. Heart rate is 72. Respiratory rate is, or your breathing rate is 16, so you're taking 16 breaths every minute, which is normal. Have you had any complications or trouble breathing?
When I had the flu, I had a cough.
Okay. All right, but how about now? Or do you have any trouble coughing? Are you having a cough? Do you have trouble coughing? Do you have anything you cough up or anything like that? Okay. I'm going to go ahead and take your blood pressure. Now we want to, I notice you do seem to be breathing a little bit with your chest. So I do want to work on what we call diaphragmatic breathing, which is a muscle right inside your stomach right here. We'll work on that. So we'll work on that as soon as we get down here. Share that just a little bit. Okay, 104/60, which is really good. Blood pressure's doing great. Now, about that diaphragmatic breathing we were talking about. What I want to do is I want you to put your hand right here, and I want you to pretend there's a balloon in your tummy.
Okay.
And I want you to pretend that when you breathe in, you're trying to fill that balloon up. You're trying to make your hand, you want to feel that balloon inflate into your hand, okay? So really fill it up and use every bit of air that we can get into our stomach. And then that'll help expand your chest as well, but we want to go here first, okay? And you can also, if you're having trouble with that, you can sniff really fast, and it'll kind of activate that naturally. And it seems like you're doing it well, but if you have trouble with it, you can sniff whenever. Next thing I want to do is just listen to your lungs, make sure there's nothing going on there. And you haven't had pneumonia or anything like that other than the flu recently?
Just the flu.
Okay. You don't smoke, do you?
No.
Okay. So I'm just going to listen to your lungs. That is going to require me to go down your shirt just a little bit, and then I have to come up from underneath. Are you okay with that? Okay. Now all I want you to do every time I touch down, I want you to take a deep breath in and deep breath out through your mouth, okay? In. 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 Come under the shirt. In. In. One more time each side. Side. Not gonna notice
All
any-
clear?
All clear, no decreasing sounds. Okay, I want to go to the back, check just in case.
Clear too.
Okay. Alright, so that's good that you've gotten the breathing thing down. You seem to be doing well with that. Okay. Now, I think you've walked in here, I think you're good. I don't know if they've explained what DVT might be to you, but if
They
you
checked that.
okay, they checked that. Alright. Well, if you remember, if it's redness or swelling or anything down here that looks really abnormal, or you have pain back here on either side, you might need to get that checked out, so really let us know. Okay? So now I want to do, notice you have some tingling in your hands and feet. I want to check that out real quick. I want to make sure that you have some sensation everywhere else to see, and, if it's up any worse anywhere in other places. So if you don't mind, all I'm going to do is I'm going to just provide a little touch, just like that. And what I want you to do is tell me if you feel it or not, okay? You just say yes, or if you don't feel it, you won't say anything, okay? Just close your eyes for me.
Yeah. I feel it, but it
It's different.
feels
Okay.
light.
Okay, thank you for letting me know that.
Yes. Yes. I feel it, but it's yes.
Okay. Now I want to just take you over here. I'm just going to take a look at your feet. Now is that stretching your hamstring and your back of your leg back here at all?
Yeah.
Okay. Come down just a little bit.
Feel it. Tight shoes.
Okay. So I'm looking at the bottom of the feet, just observing, making sure nothing
Sorry, they're probably sweaty.
crazy's going on. You got a wound here. Alright. So now I want you to tell me if you can you feel this? Is it different? It's different than this? Okay. Alright. Okay, one more thing while I'm down here. So watch you look at your foot real quick. And I'm gonna push up, and I want you to say up. If you feel it go down, that's down. Okay? So if I may go like this, up. So I just want you to tell me when you're feeling which way it's going. Okay? So close your eyes for me. Okay, very good. Alright, so now put your sock back on. And I will do the same.
Yeah.
So you see if you can put it on point. I'll do the same thing to the other side.
Other side's clear. can't really tie.
Can't tie them?
Tired.
That's fine, I'll tie it real quick. But I notice you are able to get it on, which is good. There is a little bit of trouble with it, but we can work on that.
My arm just moves too much to tie.
Yeah, well, we'll definitely work on that. We want to get you to doing as many things as you can with that right arm and this right leg. Okay? Alright, a couple more things. Can you take your, and don't scrape yourself or anything, so kind of take the back of your leg right here, and can you run it from here, so touch this leg here, and then do just like this.
With this leg?
Mm-hmm. Okay. Alright, that's good. Now I want to see the same thing. Can you do this side for me? Just real quick, just to see. Okay, so a little bit different on this side. A little worse on this side, but still got some there. How about your upper extremity? Sit up nice and straight, chest out. Now I want you to take your right hand, and I want you to touch your nose with it, and I want you to touch my finger, so it'll look something like this. And I'm going to move my finger, okay? Right hand, touch your nose, and touch my finger. Okay?
Nose.
That's good. Keep doing it. Alright, how about doing the other side? This hand. One more time. Okay. You did pretty well up there in the upper extremity. Okay. Or with your upper arm. Alright, so your posture is good. You're breathing good. I do want to just give you a little bit of correction on the posture. We want to make sure we maintain good posture because all our movement starts from here. So we get in a good position, which will be a little bit of, this is perfect, right where you're at. So kind of, do you feel how that feels?
Weird.
Does it feel weird?
Yeah.
Okay, can you pinch back your shoulder blades against my hands just a little bit? Okay, now relax, about right there. That's the ideal posture we want to sit in. So I'll try and correct you throughout, and I'll just give you a little bit of kind of, get that hip to go forward a little bit. Get the small of your back, get a little holding in there, and then we'll correct you up there if we have to. But you're doing well. So it's just something to be aware of as you go throughout the day. Okay. Now, so you're able to walk somewhat.
Yeah.
Okay. Now I'm gonna put the skateboard on you, and we're gonna see how well you can walk for about 10 feet or so. Is that too tight? Still got that good posture, I'm liking it. Okay. We're gonna come right outside. Actually, before we do that, I want to just see how well you're able to move things, how strong you are first. Okay. So, if you don't mind, could you kick your right leg out? Straight out, straight out, straight out. Okay, hold it for me, hold it for me. Don't let me push it down, don't let me push it down. Great, alright. How about this way? Hold it for me, don't let me push it down. Good. Can you pick one up, one side up, other side? Good. How about can you do that without holding on to the edge? Now, pick the side up. Good. And the other side. Good. Alright, hold that for me. Hold that for me. You can brace if you have to. Good. How about pick up the side? You can brace if you have to. Good. Can you raise your arms up like this? Put them behind your head. Okay, good. How about out front? Out front. Okay. Alright, don't let me push you down, okay? Good. Can you make a muscle for me? Both arms?
It's making me tired.
It is? Okay, well we'll rest in just a second, okay? Don't let me pull you down. Don't let me pull you down. Good. Okay, push against me? Push against me? Awesome. Okay. Alright, so you're feeling a little tired?
Yeah.
Okay, how about we get some water?
Okay.
Alright. Okay. Rest it up.
Yep.
Do you feel like we're gonna go outside and we're gonna walk for about 10 to 15 feet. How does that sound? Okay? Alright. I'm gonna ask my assistant to come with me.